Hello everyone, I'm Dilesha and I will be presenting the first part of our machine learning project on heart disease prediction using supervised learning. In my part, I will cover the dataset exploratory analysis, data pre-processing and the logistic regression model. So in the first, we use the heart disease dataset from Kaggle, which contains 1025 records and 14 features such as age, cholesterol, blood pressure and maximum heart rate. The target column called target is binary. 1 means the person has the heart disease and 0 means the no disease. After loading the CSV file and checking with df.info, we confirm there are no missing values and all columns have appropriate data types. So the dataset is clean and ready for analysis. Next, we performed exploratory data analysis to understand features, distribution, and relationships. The target distribution plot shows the dataset is fairly balanced between patient with and without heart disease. So we don't need resampling. And then using histograms, we observe that patients which heart disease generally have mm, lower maximum heart rate and higher cholesterol levels. And the correlation heat map gives more insights. We can see that features like chest pain type and thalassemia are positively correlated with heart disease, while Dole peak and exon are negatively correlated. These patterns already gives us a good medical interpretation of which factors most influence heart disease. And before modeling, we performed data pre-processing. We separated the features and target into X and Y, scaled all numerical columns using standard scaler, and then split the data into 80% for training, 20% for testing with stratification to maintain class balance. This ensures that our model performs well and generalizes properly. And for the first model, I implemented logistic regression, which is widely used for binary classification tasks like this one. After training, we evaluated it on the test set. The model achieved around 81% accuracy and AUC score of 0.93. This means the logistic regression model can correctly distinguish between patients with and without heart disease 93% of the time based on their clinical attributes. Um, and the confusion matrix shows a good balance between true positive and true negatives, and the ROC curve confirms strong predictive performance. The main advantage of logistic regression is that it's interpretable. We can look at the coefficients to understand how each medical factor contributes to heart disease risk. However, its limitation is that it assumes linear relationships, so it may miss complex patterns. To overcome this limitation and capture nonlinear patterns, we next implemented an ensemble-based model, the random forest classification. So now I will hand over to Chaya Kotivila, who will explain the random forest implementation, evaluation, and model comparison.
Hello, I'm Chaya Priyadarshini. Now I will explain the second model. We built the random forest classifier. Random forest is machine learning method that uses many decision trees to make better predictions. Each tree looks at the different part of the data. The final answer is decided by majority of vote, and this helps to avoid errors and gives more stable results. In our project, we use 100 trees with a maximum depth of 5 and at least 5 samples needed to split. These settings help stop the model from the overfitting the data. This is the confusion matrix image related to random forest. Here, the random forest model gave 93% accuracy. It predicted most cases correctly with very few mistakes. And this is the ROC curve image. The ROC curve goes close to the top left corner. The AUC score is 0.98, which means the model is very good at telling who has heart disease and who does not. When it comes to model comparison and feature importance, now let's compare both model, logistic regression and random forest. Here we generated comparison table. Logistic regression gave 81% accuracy and AUC of 0.93. Random forest gave 93% accuracy and AUC of 0.98. This shows random forests perform better in every metric like accuracy, precision, recall, and F1 score. And we also checked 5-fold cross validation here. Logistic regression is scored 0.81 plus or minus 0.03 and random forest is scored 0.93 plus or minus 0.02. So random forest is more stable and reliable here. And this is feature importance chart. Another advantage of random forest is that it shows which features are most important. The top features are chest pain, maximum heart rate, depression, number of vessels, and thalassemia. These factors make sense in medicine because they are closely related to heart problems. When talking about conclusion and future work, this is combined ROC curve. When we plot both ROC curves together, the orange line random forest is above the blue line. Blue line shows the logistic regression. That means random forest is better model. Then finally we can say logistic regression is simple and easy to understand. Random forest gives higher accuracy and handle complex data better. And in the future we can test other models like SVM and gradient boosting. And we can also try grid search CV to find the best parameters. And finally, overall, our project shows that machine learning can help doctors detect heart disease early and giving faster and data-based decisions. This is about our project results. Thank you for watching.